From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours St. Francis Health System's Director of Community Relationship Building receives the 2013 Catholic Health Association's Tomorrow's Leader Award. This year, Maxim Williams and 9 other outstanding young leaders will be recognized and honored for their demonstrated commitment to advancing the mission of Catholic health care. The Catholic Health Ministry of tomorrow will depend on strong leadership and passionate commitment to the healing mission, and we agree that Maxim Williams fits that role. Every year, the Catholic Health Association honors young leaders from nominations across the Catholic Health Ministry. Nomination criteria includes values, passion for the mission and values of Catholic healthcare; high performance, consistent contribution to the ministry evidenced by a high record of performance; leadership potential, strong emotional intelligence and behavioral demonstration of ministry leadership competencies; and contribution to community, demonstrated commitment to advance his or her community. Maxim joined Bon Secours in 2008. With no staff and a small budget, started the journey to building a healthy community in the Sterling community in Greenville, South Carolina. And this is no small feat, from laying the groundwork through door-to-door canvassing to building consensus to recruiting community leaders to work together for a common goal. Maxim has been there, not to control the process, but to guide, support, and encourage the community. He has selflessly encouraged and lobbied community leaders to partner with others for the benefit of the community. Examples include the Odessa Street Organic Garden, the Sterling Greenway Trail, and the Sterling Community Center, just to name a few. The originator of the Sterling Phoenix League, Maxim has brought together residents, agencies, businesses, and individuals with the common interest of revitalizing the Sterling community under a holistic model of health and wellness, covering everything from public safety, education, housing, healthcare, and spirituality. The Sterling Phoenix League was and continues to be a collaborative and strategic framework uniting governments, businesses, churches, community residents, and anyone interested in bringing constituencies together to better the health of Sterling. More than 40 agencies, organizations, and faith-based groups are working together, as well as hundreds of individuals in and around Greenville. Now, this is just a sampling of the many, many contributions Maxim has brought to this idea of building healthy communities, and hopefully gives our viewers some insight as to why he was chosen as one of Catholic healthcare's leaders of tomorrow. Please join us in congratulating Maxim Williams, Bon Secours St. Francis Health System's Director of Community Relationship Building, and now Bon Secours' latest recipient of the Catholic Health Association's Tomorrow's Leaders Award. In other news, February was Black History Month, and there were many events across the system that took place. Today, we will share with you just one of those events because we happen to have footage of it. On February 26, 2013, Bon Secours Health System's HSO held a Black History Month celebration at their Columbia location. The program featured an elementary school choir, musical and vocal soloists, a fashion demonstration, and much more. Here's Angie Rodriguez to talk a little bit about what that event offered.
I'm Angie Rodriguez, and I'm the Manager of Standards and User Competency for the Lawson team. As luck would have it, I happen to be the co-chairperson of the HSO Diversity and Inclusion Committee. Well, the first thing, what we wanted to do was have different types of performing arts, during the program. And I wanted to be able to spotlight our saxophonist, and his name is Benny Woodson. And so I thought, well, wouldn't it be nice if he set the mood? And then after that, we had our wonderful MC, and she really helped me. Her name is Katrina Walker. She's also on the Diversity and Inclusion Committee. We had a beautiful reflection that was given to us by Debbie Pettis. Let her select it, and she found what she thought was the perfect one, a message that she wanted to say to everyone to commemorate the event. And then from there we went to the children's choir. 25 children, 25. They just kept coming and coming and coming. So they were so excited to be there. We had a wonderful fashion show that was given to us by Miss Eileen Jessie Twong, who is actually from Ghana. And she wore a beautiful native garment, and the style is called butterfly because it has beautiful butterflies all over it. After the choir, then we had this wonderful oratorical winner, and he was the first place winner for the 2013 WJZ Baltimore or Black History Month Oratorical Contest. We had the most amazing soloist who happens to sing at our administrative assistant's church. And she so graciously took off today to be with us and to share her wonderful talent. I want to say, that I hope that by being able to hold our very first Black History Month celebration, it's something that we can continue to do, that we can carry this tradition forward.
The Bon Secours Diversity and Inclusion Committee, helping us celebrate our diversity. Finally, in recognition of Black History Month, we've told you the story of Dr. Sarah Garland Jones before, but we think it's worth another look. Dr. Jones has the distinction of being the first African-American woman licensed to practice medicine in Virginia. And if that is not enough distinction, she was also the founder of what we now call Bon Secours Richmond Community Hospital. Sarah Garland's birth year is uncertain, but it was just after the Civil War in Virginia. Her parents, George and Ellen, moved to Richmond in 1863. Sarah graduated high school in 1883 and taught for 5 years at the Baker School, where she met her future husband, Miles Jones. They married in 1888. That same year, a city ordinance went into effect forbidding black men from teaching in public schools. Miles took a position at a local bank, but Sarah chose to study medicine at Howard University. She graduated in 1893 and returned to Richmond to open the Richmond Hospital. This original hospital was located at 406 East Baker Street, supporting a modest 25 beds. Sarah then helped her husband through Howard Medical School, and they built a prosperous practice among the black and white communities. She died on May 11, 1905. After that, the Richmond Hospital and Training School for Nurses, now 50 beds strong, was renamed the Sarah Jones Memorial Hospital. The hospital was moved in 1932 to Overbrook Road and in 1945 was renamed Richmond Community Hospital. Today, Richmond Community Hospital is a 104-bed hospital located at 1500 North 28th Street in the Bon Secours Consortium. But her roots go back to 1893 in the hopes and dreams of a young black physician named Dr. Sarah Garland Jones. You can read the complete Sarah Garland Jones story in the book entitled True Richmond Stories. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.